Today's talk is by Dr. Safdar Khan. Dr. Khan holds the Benjamin R. and Helen Slack Wildberger Endowed Chair in Orthopedic Spine Surgery, as well as is the Chief of the Division of Spine Surgery and Vice Chair and Associate Professor in the Department of Orthopedics at Wexner Medical Center at The Ohio State University. Prior to clinical orthopedics and spine surgery, Dr. Khan spent nearly 4 years performing benchtop and clinical research at the prestigious Hospital for Special Surgery in New York City. This was followed by a 6-year residency in orthopedic surgery with a research year built in at the University of California, Davis. There, with his mentor, he was the first to identify adipokines as playing a significant role in fracture repair during his research year. Residency was followed by a fellowship at the prestigious Rush University Medical Center in Chicago before moving to the Ohio State University Wexner Medical Center to develop a spine service in the Department of Orthopedic Surgery. He has also authored over 200 research publications, over 18 book chapters, and has presented his research numerous times, both nationally as well as internationally. As much as overwhelming that introduction was, today Dr. Khan will draw on his personal experience and reflections to discuss how to overcome challenges and lead from the front with resilience, and a topic I feel that he is very well equipped to talk about. So without further ado, I'd like to hand over to Dr. Safdar Khan. Once again, thank you so much for accepting our invitation, and we're honored to have you here among us.
Well, thank you very, very much for that introduction, both to Asma and Saad. It's a real privilege and pleasure to be here. Certainly, your dean, Aisha, Mia, we were medical students together back in the class of '98. So when she called me, there's nothing I wouldn't do for my good friend Aisha. So this really is an incredible opportunity for me to reconnect with a lot of you and to be able to give you a few things that I've learned over the years. So before I start, I do want to very quickly say that my story is a different script. And the things that I've learned are perhaps along the same lines as many people that you interact with every day, whether it's Aisha's story or whether it's your Dean Adil Heather's story, whether it's anybody who's achieved anything, who's in Pakistan, who's overseas. I think the script is maybe a little different, but the tenets and the base is all the same. So I'm humbled to be able to share with you my story, but it's really no different than people who have done amazing things in their personal and professional career. And maybe you'll see that in the thread of the talk, that the same characteristics that you may notice of people who we consider successful. Again, it's no different. So it's with all humility that I really appreciate you inviting me. So when Dr. Mia asked me to speak, and I think my computer's a little frozen here. Let's see. She asked me as part of this talk was how resilience and perseverance shaped my life, and what if these lessons that I've learned could be used to reshape and potentially reinvent in a post-COVID world, in this pandemic that we're living in. To me, it's all about and great. All have to look at things differently with a different perspective. And one of the things that I often find interesting, wherever my travels take me, is how quickly we can stay within one box and we refuse to look outside the box. And that ability to be able to look up over the horizon and try to imagine something different, whether it may be relevant, whether it may be possible or impossible, is really in my mind a personal perception. Your own perception will drive your own reality. And I think what we're seeing in this COVID time of pandemic and lockdown, I think there are more opportunities in this lockdown than the things that we complain about or may face. Like I said earlier on, what may be most relevant to the participants, whether it's the students or it's the faculty, is potentially my journey from Pakistan, from the class of '98, and the jump to academic orthopedic surgery and then spine surgery. And I know that orthopedic surgery is an incredibly difficult journey to take and task with. And I know of maybe 2 or 3 medical students from Aachen over the long tradition of Aachen medical students coming to the US who have gotten into orthopedics. So, I wanted to share a few anecdotes about that. Maybe that'll help in answering some questions about resilience and perseverance. And then once you get up to the mountain, it doesn't mean that the climbing stops. I mean, in addition, perhaps share with you 2 examples of how I've approached challenges and applied lessons to practice using a different perspective potentially. So when I say Quo Vadis, and I'm curious every time, in every talk that I give that may be a talk that is a little outside the medical specialty, Quo Vadis was essentially Roman soldiers back in ancient times would ask people who weren't uh, Romans, of people that they had subjugated. They'd ask them, "Quo vadis?" or "Whither art thou going?" Really, as sentries entering cities, they would sort of challenge people, and that's a good question to ask yourself internally. Where are you going in any phase of your life? Do you have the pathway laid out for you? So at every turning point, I remember this phrase, or this Latin phrase, "Quo vadis," and I like to ask myself, which way am I going? Where is the wind blowing, and which way do I have to readjust my sails to navigate the seas of uncertainty as there would be? COVID 2020, and this may be relevant specific to the invite, has obviously been a new issue and a worldwide challenge, but it's a new turning point, and I think it allows all of us to ask ourselves that same question: where are you going? What are we going to do, both internally, externally, within our lives, to manage the stresses that come with a lockdown, and or how does that change our life view, and what we can do to overcome any challenges in this time. As I was putting this sort of presentation together, one of the things that I started writing down words that I think describe the way I handle either stress or uncertainty, or any time of problem. And I actually circulated the list of words around to people who are very close to me, mentors, friends, my significant other, my wife, and they sort of helped me pare down the list to these words of you're fluid, you're adaptable, you're nimble, you're creative, you're innovative, you're easy to pivot, you're very pliable. So, putting those together, I tried to come up with a creative mnemonic. All I could come up with fancy PP, which I'm copywriting. But it essentially, I think, is a reflection of what other people mirrored in sort of my journey, where I think if I look at the last 22 years since I left Pakistan in '98, it has been about being adaptable and nimble, trying to pivot from one situation to the other, and being very flexible and almost versatile. And so if you can continue in any time of crisis, be able to absorb a lot of information, a lot of input, but then also use that in your decision making, but try to be creative and try to be innovative, try to see the world through a lens that no one has ever seen. I think it helps to bring a new perspective, a fresh perspective to the situation. So again, my story, the script is maybe a little different, but the work, the dedication is no different than what Aisha Mia put in, or Adil Heather, or Saad bin Umar, or Rizwan Sohail, all members of my class of '98. And obviously all your faculty members, and everyone has a script, everyone is successful in what they do. My humble assertion is, if you want to know about my journey, if I can help educate my pathway, again, it's no different. I committed to orthopedic surgery early. I think it was the 3rd year of medical school. I had worked with incredible faculty members in orthopedics who are still good friends to this day, and they were just a cut above for me. I could just see myself do that. So I really burnt my boats at the end of medical school. I couldn't conceive doing anything else. And that in my own mind was, I'm just never going to go back unless I achieve this goal. My family were just regular middle class people. Both my parents were PhDs. We didn't have a lot of resources, so I just remember in those days we could do a one-way ticket. My father handed me a few $100s that he could afford in a one-way ticket, and he said, "Good luck. This is all we can do." And so I really didn't have a choice. There wasn't anything that I could sort of fall back on. So for me, that was a turning point, right? We talked about turning points and quo vadis. Which way am I going to go? Do I, try to live probably what would have been an easier career or life, I guess, with my parents back in Pakistan, or I just burn my boats and I just go into uncertainty? And I think that was the driver behind sort of this deep sense that I just couldn't go back because I had burnt all my boats. I just had no ability to turn back. I gave myself 2 years, and I told the people I was doing research with in New York that I'm going to give you guys 2 years. I'm young. I was 23, very naive. And I said, I'm going to be giving you 2 years. And then I learned along the way. I started doing benchtop research, and I was always very hungry to learn. And I think they saw that. And I tried to make myself indispensable. And at that point, when I came in to doing research, I really wanted to do musculoskeletal oncology. That was a big passion. I had worked with Gary Friedlander, and Dr. Masood Umar was very interested in oncology back at NAKU. So I kind of wanted to do something in musculoskeletal oncology, but the only job that I got was in spine. And I had no concept of spine. I never thought that, I'd develop a passion for spine. So I pivoted because everything that I was getting input from was, well, musculoskeletal oncology is great, but I'm getting a lot more opportunity to establish myself in spine surgery. So that then laid the foundation of, research into a dedicated specialty that then allowed me to start my academic journey. 2 years became 4 years. And that was, again, a turning point for me because I wasn't prepared to stop research. I got myself in too deep with a lot of scenarios where leaving to go and pursue clinical medicine was becoming more and more difficult. Some of it was, internal inertia that when I did ask myself at a turning point, where are you going? You've burnt your boats. You have to either go on and get a PhD in orthopedic science, or you have to make a big decision and see if you can apply and get in. So my biggest challenge was at that 4-year point in my journey. One of my peers, 4 years into their after graduation, um, many have done internal medicine residencies, or they're doing surgical residencies, and they're on their way to their careers, and they were getting married, starting families, and life was going on. And my family and my friends were asking me, well, what are you doing? I mean, you're stuck doing this research. Your career seems to have stopped. So finally, at year 4, I applied for orthopedic surgery, and I think I got 3 or 4 interviews because my mentors picked up the phone and they said, "Look, you have to interview this guy." And I interviewed at UC Davis in California. And I remember in the interview, they said that you're a qualified candidate. We'd love you to join us. However, there's something off about your visa, that we'd have to give you a J1 visa or whatever the scenarios. I forget specifically what it was. This is now 14 years ago. And I said, I just can't do that because I didn't want to change the status that I was on. So here was, again, a moment in my life, the turning point. We talk about, different aspects. Is 4.5 years, 4+ years of research. I had gotten countless favors from people to get me a residency spot, at least an interview. I had the single-minded focus, but I had actually not done my due diligence. I had forgotten about the visa scenario. I was, just maybe careless. I had paid the price for that. And at that point, I couldn't foresee going forward. So I remember sitting down and saying, well, there's this department of orthopedic surgery in a very well-established residency who's wanting to hire me as a resident. in my lifelong ambition and passion. I've done so much, my life can start, but I can't get this change in my visa. So now I'm at the crossroads. And I told them, I said, well, how about I withdraw from the match? I made the decision. It was a very difficult decision, as you can understand, to withdraw from the match and say, I'm not going to apply this year. I'm going to try to get my visa sorted out and situated. Can you at least do me the privilege or the favor of interviewing me again next year? And you can imagine the precarious nature of that in any residency, let alone orthopedics, where you really, in my mind, have one shot when you apply. So I was at a crossroads there, and in my mind, I was, well, how do I pivot? How do I adapt to this scenario? And I found this accountability ladder years ago, and I really find it important even now as I progress and I talk to our residents and fellows and medical students, et cetera. Is there's some powerful ways of staying accountable. You can either get on with it, find solutions, you can own the issue, or if the lower rungs of the ladder you are unaware, and then you start blaming other people and there are excuses to be made. And I think the first couple of weeks after that reality hit me, I was on the lower rungs of this accountability ladder, where because I was unaware of the scenario and the visa and this, I was blaming other people, blaming the GME offices for giving me an interview and not understanding and letting me know ahead of time. I was making excuses for myself. But as you mature and as you go on, and where I really have to recognize is my mentor, Harvinder Sandhu, who is a spine surgeon and director at HSS, that I worked with him. I still continue to work with him. He got me to the upper rungs, and his the way he comported himself was I really felt that I wanted to mirror my career after him. And he was already on the powerful side of the accountability ladder. He said, you have to find a solution. There's no problem to which there's not a solution. You just have to get on with it. And I said, well, as I look at it, I have to change my visa, and I need a lawyer, and I don't have the resources financially to do so. So he said, okay, well, why don't I give you a loan of whatever it was. It was a couple of $1,000s at that time. It still is a large amount of money. And I said, okay, then let me do this. If you give me a loan for this amount of money, then every month in my paycheck, why don't you take whatever amount of money away, a couple of $100s, so I can pay you off for this loan? And he said, no problem. Talk to the business manager. So I did, and I ended up paying a lawyer. I got the visa changed, and then I went to him, to the business manager, and I said, well, I'm ready for you to start taking the money away, because it had been a few months. And she just looked at me in the eye and she said, Dr. Sandhu never wants to hear this again. He never wants you to bring up the loan. He said, just go ahead and tell him to pay it forward wherever he goes. And that again, in the moment when you have someone in your corner like that, and who showed me the way to find solutions, how to get on with it, how to problem solve, how to pivot and adapt, was, not only his incredible generosity, but I think within that was just a way of life that I knew that I wanted to do as well. So subsequent to that, you think of you can stay and think, and you can get muddled in your mind and your brain. And I know that there's a lot that actually I know Dr. Mia Aisha has put on LinkedIn and on Facebook about just how you can get trapped in your own thinking. But there are differences between the thinkers and then the doers. And I think at that moment, when I was ready to reapply and re-interview, I was a different person. That challenge in my life was probably the hardest challenge that I faced about withdrawing from the match, because it was, two roads that I was going to take. Either I was going to try to do something no one has ever done, or I was going to go and maybe change my focus and then try go back to clinical medicine and do something I never wanted to do. So the pivot point really was, trying to be nimble and adaptable and try to find solutions for problems. And this example may be just of for a visa, for a residency, et cetera. But I think you can apply that across the many issues or concerns that we face every day. So as Asma mentioned, I ended up matching at UC Davis, and then it was once this happened, then there was no turning back. The perseverance and then the resilience and staying focused and making sure that every day counted got me to then being recruited to lead the division. I remember I was the only one, the first one that they recruited to lead the division. I then since have recruited 3 other partners. There are 4 of us. We developed a footprint. Before it was very neurosurgery driven, spine surgery was. We were able to bring clarity to that relationship, and we now have a co-division. We split call. We do cases together. We really have run a very fluid and very mobile a program for spine surgery. And that's where I found my passion for reconstructive spine surgery, where we take care of the sickest and the most complex spine cases. So you want to be the guy in the front at every, or the guy or gal in the front. This is not meant to be a gender specific, obviously, but you know, I've always wanted to think outside the pack, and I think the early lessons I learned drove me to make these choices. Again, this has not been without significant failure. I don't want anyone, obviously, to think that I or you know, people I'm sure before me have not had significant failure in life. But as long as you put your head down and you understand the aerodynamics of success, which is just putting your head down and pumping as hard as you can be the person in the front in anything you choose to do. The last 2 things I was going to talk about was once you reach you know, a certain stage, and once you climb up and you feel like you've approached maybe a plateau in your career, that's when you have to do the same thing. I did quo vadis for myself. I said, well, I've achieved pretty much what I had set out to do over the course of 20 years. Now, where do I go from here? And you know, in the medical center, we were talking about efficiency and you know, efficiency and computational invoicing of implants for orthopedics. It was slow, it was flawed, it lacked sort of an elegant pattern. So instead of complaining to the entire health system, and instead of complaining to individuals within the process, I just started a company. And you know, now we have a fully fledged software company that I co-own. Own 30% of this company, and we're national. We, you know, again, the fluidity and to be able to adapt and be nimble in any situation. Don't stop thinking. Don't stop pushing yourself, no matter where, how far you get, or where your goals and targets are. You may find out that the target, achieving it along the way, you do a lot of perseverance and you stay resilient. But along the way, you can do so many different things that you can be proud of. In addition, you know, part of my biologic research that I do with the cell biology group here in the School of Biomedical Engineering is try to do and understand tissue engineering strategies. It's very limited if you understand the total disc environment, the intervertebral disc environment, the spine. And we've had terrible results, but we kept pushing and pushing forward. And we came up with this novel concept to reprogram cells, where we can insert engineered vesicles to have native cells start developing proteins essential healing. So we ended up doing it, and we ended up getting a patent from the U.S. government that we co-own this right now. So, you know, again, I'm wrapping up now, and I'm really humbled and gratified for the opportunity to share a few anecdotes that have shaped my life. You know, I use, you know, wherever I end up in my life, even now, day to day, I'll ask myself in any turning point, you know, how do I navigate this? What inputs am I getting? What outputs do I have to do? At every moment, I've been privileged to have friends, partners, colleagues to learn and absorb from. So you can learn from everyone, sometimes good things, and you can learn how not to be, which is just important as how to be. And the good comes with the bad. What you may have seen in the last 20 minutes is sort of things that I'm most proud of, or positive aspects of my journey. There are also some very negative things that, or things that can turn your ship around and get you into a cycle of disappointment or frustration. But you have to keep your head above water at all times and think of things as background noise. You just stay focused. And I actually envy all the students. I'm incredibly impressed with Akan where it is today, not nearly because of the great leadership that you have now, and before, and the faculty that I know that I keep following. I envy you because we had a different shift in a different time, and now with so much knowledge, you guys have the ability to do anything. And Khan, certainly, I'm sure the faculty will attest to how wonderful things are and what great things are going to happen. I'd like to leave you with the last thing that I have framed at my bedside. So I look at it every morning when I wake up. Is this quote from Rumi: "My heart is so small, it's almost in a higher power, such big sorrows in it. So look," he answered, "your eyes are even smaller, yet they behold the world." And if you look at the world through a different lens every morning when you wake up, you may find things that you never found within yourself and within your external environment. And that may help you refocus and redefine any difficult scenario, whether it's COVID-19 or it's any challenge in your life. Again, I'm very grateful and humbled to be talking to you guys today, and thank you very much.
Thank you very much, Dr. Khan. It was really interesting to hear your story and how your journey has taken so many different turns and how you had to pivot in so many different ways. We've got a few questions from our participants right now, and I'd like to jump into the first one. I believe this is from a medical student. His name is Saad. How can we focus on our goals in academics, especially when there are other decisions we have to make in uncertain times, like burning our boats? We might get second thoughts for the tough decisions, and those second thoughts could cloud our judgment. So how do we maintain our focus?
Yeah, so that's number one is difficult, right? Because you're torn in all different directions. I think, you know, there are two ways of approaching it. Number one is a philosophical way of approaching it, and the other is a real world way of doing it. For me, if I were to give my example about orthopedics as a medical student, 4th year, you know, 5th year, there was a lot of background noise. So almost every textbook that I had, I would write down my name and I would write professor of orthopedic surgery, you know, XYZ. I mean, my mother, when I was in Lahore last year, she gave me a couple of my old textbooks, and I was leafing through them, and almost every textbook had my designation written, and I was a 4th year medical student, and it's no different than what I have on my card now. So to me, that was, you know, you just have to have it in writing in front of you. Either you put it out there, you frame it, and that's what your dicta has to be. That's what your focus has to stay. And that's a real world sort of practical way of keeping you on track. Philosophically, it's just noise. You just have to think of it as background noise in life. Whenever you, I mean, when we used to study in the AQ cafeteria, we put headphones on because there was a lot of background noise. We'd listen to music to stay focused. There's no difference in life. There's going to be background noise. If you can stay physically and have something in front of you at all times, that'll guide you.
Thank you so much, Dr. Safdar. I'll be taking the next question by Dr. Murad. So he's asking, how do you see being ambitious versus being motivated and having initiative? And he follows up by asking, where do you place integrity and ethics in your journey? Is it a given, or do you have to cultivate these ethics?
That's a good question too. So, you know, what I've seen over 22 years of having gotten to this place in my own career is that a lack of integrity and lack of ethics can get you far, but it will only get you so far. At some point, and this is something that I've seen countless times in my career, both in orthopedics, in medicine, and then outside of medicine, and in everything that I have done, is if you're not honest and truthful, you don't have integrity, and you can't translate that in behavior, then at some point you'll have short-term gains, but you'll lose the long-term. And so that's, I think, extremely important to always stay honest and above board. And most importantly, I think you have to stay honest to yourself, and be not necessarily have a facade of honesty and piety, etc., but stay honest to yourself. And the second point is about ambition. And ambition is good as long as, in my opinion, again, your life to me is like a pie, and you have only so many slices you can parse out your pie. So you can have incredible ambition, and you can have a very big slice of your pie in your life, but then the smaller parts are gonna get equivalently smaller time for you. So at some point you have to pivot, and you have to say, is my going for this next grant or this next position or this next professional goal, is my ambition going to override my family? Is it going to take away from my friends? Is it going to take away from, and it's been very difficult for me personally over the last 4 or 5 years to make that decision, because I do get invitations to be chair at many well-regarded orthopedic programs in the country, but I know if I do that, that will be fulfilling an ambition maybe, or fulfilling something that I want to do, but it will be for my small family to uproot them from where we are. The cost benefit, or that would be too much. So that's where you have to pivot and understand what's best, and make those tough decisions.
Thank you for that. Our next question comes from Hania Shahzad, and she asks, in your opinion, what are the challenges that have emerged or resolved since your time as a student and as an up-and-coming physician, compared to someone who is pursuing an orthopedic surgery route today, or medicine in general? So the challenges in your time versus today.
Well, there's no question that back in back in the day, we could get a one-way ticket to the US from Pakistan. And now, the world has changed. I don't know if medicine has changed as much, but the world has changed. And, travel, the ability to integrate yourself in the United States, at least, in a academic residency, is just becoming difficult, especially a surgical specialty. So I think the challenges back then were a little different. I think the challenges back then was we didn't have forum like this. We didn't have the ability to be able to reset our thinking, or be able to have people refocus us. It was really a little bit of trial and error, but we had, I think, a ground that was a little bit more fertile. We were able to make inroads into the United States, into tough specialties, at least surgery, and then obviously orthopedics was always tough. I think it's just gotten tougher and tougher as time goes on. To now, where I think test taking has become a lot easier. I know they're doing away with USMLE Part 1, and all that stuff is going to make it a little bit more difficult for AKU and all medical students. So that's where I think persistence and resilience is going to come in. If you do decide to take this, you're going in with your eyes wide open. I would even say that me burning my boats was probably naive, and I succeeded by hitting my head and falling and just picking myself up, and I kept going, because I didn't really have other choice. Here I think you have choices, and be flexible with those choices. It may not lead to orthopedics in general, maybe it won't, but maybe it can lead to something else that can be just as fulfilling and just as important.
Thank you so much, Dr. Safdar. Our next question is from Robert, and he's asking as to how COVID-19 has affected your work. And if I may just add up to that question, that we're all in unprecedented times, we're all in the same boat, and this is another chance for all of us to pivot. So it'd be really interesting to hear as to how you're taking this opportunity to pivot once again.
So absolutely, COVID has obviously impacted everything, and taking care of patients, doing research, having this triple threat of clinical productivity, teaching, and then doing higher scale research has been obviously the focus that I've had for my career. Even to this day, when COVID hit, we knew that clinically we'd have to go down because we weren't able to interact with patients and so on and so forth. So again, this is an opportunity. The opportunity in this was to develop a telespine program. And what we did was we worked with the health system. A year ago, we had maybe 85 I'll give you figures from April 2019. We had 85 total telemedicine visits at Wexner Medical Center. In April, May 2020, we had 30,000 telespine visits or telemedicine visits. A significant of that amount was spine, orthopedics, musculoskeletal, et cetera. So we utilized that. I'm not going to take credit for that. It was the entire telemedicine program that came up almost overnight, where we had a 5-week run where we had, high-level meetings of how we're going to develop the infrastructure, how we're going to train people, how we're going to get buy-in from the insurance companies, how we're going to get, patients accepting this technology, how do we work the kinks out, what's the ethics of all this, how does the health system make money out of this. We had a 5-week run, and that was, again, exciting. Like, I would say that was a challenge, but it was exciting because we were doing things that no one had been thinking about. We were in new territory, and we were finding new ideas and innovative, creative ideas to do things. So I look at COVID as, it's been almost a blessing, because I know that post-COVID, I'm still going to utilize telemedicine because it's a fantastic opportunity and a fantastic way of doing teaching and research as well as clinical care.
Thank you. Our next question is again from Dr. Murad. He asks, how important is it for physicians to focus on public health, health promotion, and disease prevention, as opposed to tertiary care curative model? How much of your time do you spend in preventive orthopedics as opposed to the cutting edge basic research?
Yeah, that's a good question too. And what I will say to that is, I think there are different silos that we look across the enterprise, the health center enterprise, and every model is different. If you go to a city like Chicago or Los Angeles or Karachi or Lahore, every city has a different culture. Every city has a different infrastructure and different needs. In Central Ohio, we're the biggest health center, and we're a Big Ten school. So we have a medical school, we have a very large undergraduate campus. We have, on the same campus actually, we are a university, so we have the School of Engineering, we have the medical center, we have the School of Architecture, we have the business school. It's all within walking distance. So as far as the health of Franklin County and Central Ohio is concerned, we have a entire group of dedicated physicians that their only job is the preventative, the protocolization of medicine, so we decrease healthcare costs, et cetera. When they trickle down to myself, and I'm a tertiary provider, in the patients that I see specifically in my practice are the ones that are the most complex ones. So I've carved my own niche out to be able to address that part of the healthcare problem. In our musculoskeletal enterprise, we have different physicians and different tiers of physicians that adjudicate resources for public health, for good back health, good spine health, et cetera. And there's, importantly, probably more important, is that there's crosstalk between us. So that communication and crosstalk allows us to understand each other and allows us to take care of patients.
Thank you so much. Our next question is from Dr. Sana Siddiqui. And she's asking as to what kept you going and helped pull yourself up when you decided to withdraw from the match, which we all understand is a very, very difficult decision. So what kept you going at that point in time?
I would say, again, that I really had no choice. I burnt my boats. I knew that I'd put 4.5 years of research in. that time I think had to be counted. Like I needed to make sure that I didn't spend 4.5 years just, I published a ton of papers, but then there's nothing to show for it. And there was just something inside me that, after I had gone through the initial phase of blaming myself, blaming others, and being angry and frustrated, after the few weeks of doing that, I sort of just dusted myself off and I said, you know what, I just have to move on and I have to make this happen. Sometimes, and maybe I didn't pivot there. Maybe my pivot should have been, you know what, I gave it a good shot. Why don't I go into, a rewarding specialty like, internal medicine or psychiatry or, general surgery. But that's where I think it was the single-minded resolve and dedication. It was difficult, but I honestly have to tell you, 20 years later, I don't think even then, after I withdrew from the match, that I had any doubt in my mind that I wanted to do anything else.
Thank you. Our next question comes from Khadija, and here she asks, your experience moving from Pakistan to the US, how did you find the diversity and the difference in cultural, social, and political contexts to impact your perceptions of leadership, your experience of leadership, and resilience?
I think that's where being versatile helps. I think that's where adaptability helps. And I see that, in some of, not specifically from Pakistan, but, I see that in some colleagues and friends who try to, bridge two cultures, and they come over and, try to be part of the community and so on. So where there's definitely a cultural bias in medicine, especially in surgery, that's changing with time, and certainly AQ graduates have done so well over the last 10 years that now just taking that name of the institution is in order to. But back when I was starting this, yeah, culturally it was very different. It was very monochromatic. It was difficult to perceive how things would change, and that's where my mentor, Dr. Sandhu, he, really, there's noise and then there's noise. For me, the cultural side and the work is what, at the end of the day, no matter where you're from, if you do the work, and the work is of very, very high quality, at the end of the day, at least I've found in my journey, it doesn't matter as much, as long as you're able to understand each other's perspective and allow people to, live and let live. People at the end of the day really recognize good, hard work. So my only advice in that question is just do the work. Don't get bogged down into culture, bogged down into, anything else. Just do the work and stay focused on the work. And I think they'll reap benefits.
Thank you so much, Dr. Safdar. We have another question from the audience, and it's a very important one indeed. So she talks about if you could shed a little light on how you built the contact with Dr. Sandhu, and just to extrapolate that question, how do you go about approaching mentors, and who should you consider approaching? Like, what qualities should you look for while approaching a mentor?
Yeah, so it's serendipity. A lot of so I've also seen people end up with mentors that have not been very helpful. For it is really serendipity. Sometimes those are things in life that can't be scripted. But if you do get the opportunity to meet someone who it has a track record, who is a good, I mean, honestly, when I met Vin first, he was a young junior assistant professor. He wasn't someone who was who he is today. I had done an sub-I at Yale, and I had spoken, during my sub-internship at Yale in orthopedics. This is 1997, I think. I had, while I was doing my research, my sub-I, I knocked on every single door for an opportunity to do research. So I talked to the chairman there, I talked to hand service, I talked to the spine service, I talked to everyone in the division and the department, and everyone said no, except one individual, Dan Green, who's a pediatric orthopedic surgeon. He said, look, I'm interested, you know, why don't you come after you graduate and we'll do some research and I'll pay you, and so on and so forth. I was, this is great. I came back after my sub-internship in the last year of medical school, and he sends me an email saying, well, he's not at Yale anymore. And there again, here's a challenge. Like, I had told my parents, I told everybody that I've got this sorted out. I just need to, you know, pass my last part of the medical school exam, and I'm going to Yale to do research for 2 years. Dan left Yale and he ended up at the Hospital for Special Surgery. And he said, you know, if you want to come with me, you can come, but it's New York City. It's going to be difficult, and so on and so forth. So I ended up going to New York with him. I followed him down there and I worked with him for a while. And he, I think, recognized that I wanted to do bigger things, because he was actually writing me a personal check every 2 weeks under the table. And it was like, you know, there were no grants there at that point. It was just, you know, I saved up money to do step 1 and then step 2 and step 3 from those little, you know, checks that he would write to me every week, plus pay rent and have food and so on and so forth. So that's when he introduced me to Vin and Sandhu. And I remember the first meeting I had with Vin, he was 40 minutes late and he seemed distracted, and he didn't seem like he kind of knew what I was talking or what I wanted to do. So I was really disheartened. But, you know, in time, that relationship developed, and you know, he has been and still is, he and his family are a huge part of my life and my family. So it's tough for me to answer that question. It's, I think, a little bit of it's serendipitous, and I think good people and hardworking people, they coalesce. So if you have the right vision and you work with integrity and you work really hard, and I think you'll be a magnet to good people who may then propel you and push you forward.
Thank you. The next question is one that has come from a deeply personal comment from one of our participants, Rama. She essentially, I've tried to condense this. What advice would you give someone who is feeling deeply stuck and unmotivated due to a series of setbacks in academics, personal life, and someone who's now also struggling with mental health issues? How would you suggest that they try and move forward from a place where they're really not feeling that there's much hope for them right now, or they don't have a sense of direction?
Well, I will speak to that directly to Rama, and I would tell you that everyone needs help. This journey, again, what we see on the outside, and what we term, when I started this talk, was what success is. You know, success isn't multiple lines underneath your name. Success isn't, you know, having, you know, whatever in your life. Success is staying happy and being able to cope with the challenges that life bring. Um, I absolutely, at every step of my life, have reached out for help, whether it's for mental help, whether it's for, you know, physical, emotional succor. I would absolutely highly recommend going out and seeking help. And there's no shame in seeking help. I think this is one of the things that the stigma that we have to fight every time, even though we're in these specialties and we're high performing individuals. My wife is a psychologist, and she's taught me that, you know, we talk to people because we're normal. We don't talk to mental health professionals or to friends and family because we're abnormal. We talk because we're normal, and part of what you're experiencing, Rama, right now is normal. So to reach for help and to talk about your feelings and to work with, you know, a coach or a therapist or a friend or family member is normal. And you know, there's always, you know, it's always dark before sunlight, right? Before sunrise. So my only hope for you is definitely reach out for help. Reach out to whatever resources are available for you. And remember that life is built up of transitory segments. You know, this too shall pass, and you will succeed, and you will survive. And there's nothing more important than being happy. And so I would encourage you to reach out to the resources that you have. We all have, I have, and all high-performing individuals have.
Thank you so much, Dr.
Asma, go ahead.
Yeah, thank you so much. And I really liked how you spoke about where we seek help because we're normal. I think it's a very interesting take on mental health and the importance of reaching out. We don't have any further questions from the audience. I have a question of my own. You spoke a lot about adaptability, and you gave a set of qualities that are required for you to survive in this ever-changing world, including innovation and being creative. So a lot of these qualities come very naturally to people, yet others may not be very natural at it, and would want to cultivate these qualities. So what advice would you give to those? How can you be proactive in developing these qualities, being adaptable, being creative?
Yeah, Asma, that's a really good question, and it comes back to the fundamentals. I was earlier on in my career at Ohio State, I was nominated to be part of what's called the Faculty Leadership Institute. So they selected young up-and-coming leaders in individual departments, and we had a I think 3-month lecture series that culminated. Was it a year? I can't remember. I think it was either way. It culminated in a certificate and blah blah blah, and it was a talk or a lecture series. How can we didactically allow people to think differently? I don't think there's you can't switch on a gene to start developing the proteins for adaptability or versatility. I think it's something that you have to really engage internally with your mind. And the quote that I've left on the screen sort of is a little bit of a guide to that. For me, from day one, I read. Reading has been, biographies, history. I don't have a lot of nonfiction in my library, but I have a library of, I think, over 2,000 books, and they're all about history, World War I, World War II, the Byzantine Empire. I mean, everything that you can think about history and culture and so on and so forth. Reading that gives you such a wide perspective, and reading gives you such a wide perspective of quality that, for me, if you look at, adaptability and versatility, you just have to go and bury your nose in a book, and then it's on all of us individually to try to turn on an inducible gene, to try to start saying, hey, let me start making decisions. And that comes if you have your eyes widened to what possibilities have, and history is a great example for that.
Thank you very much, Dr. Khan. I would now like to invite your old friend and colleague, Dr. Aisha Mia, to make a comment and ask you a question.
Sure.
All right. So thank you so much, Safdar. This was great. Really, I think, whatever I have known of you, things have just somehow, I think, in all of these years, just gotten polished, and the sort of philosophical end of you, I think, really brings a well-roundedness that I think you didn't talk about as overtly in your sort of talk right now, which I want to highlight that. So from for however long that I've known you, from day one of med school, I think all of us knew was that you were going to be an orthopedic surgeon, and I think that piece has really been central to how you've kind of continued to have that sort of single-minded focus. So my question is going to be twofold. One, I think that in things that you talked about in terms of pivoting, in terms of being nimble, being flexible, I think that all of that comes out. It's very important. The thing that you didn't talk about as much, but I think is very evident from just your talk, your conversations, the anecdotes that you've given, is humility. It really comes out, and I'd love for you to talk a little bit about that, how important it is in terms of, also when failures strike any one of us, where does humility come in, and how important is it to continue? And then also, my other piece would be, you had that single-minded focus. Not everybody has that. It's probably a little bit of a question that Asma also asked. Is that important, or people can have different avenues, different ways, different pathways, and those work out fine as well, as long as the fancy PP is there?
Thank you, Aisha. So what I will say, Aisha, is I'll divide that into maybe three separate answers. Number one, for day one, I wanted to do orthopedics, and that was, there's a trap in that. And what I would say the trap in that is that then that defines you as a person, and that can really define how you look at the world, and it can define you as something that if you have to change or if you have to pivot, now you have, how many years of saying, this is what I'm going to do, this is what I'm going to do. And if you have to change, that becomes even more painful. So I think within that is, maybe a deeper understanding of, and everybody's situation, as you know, Aisha, is different. I think for me personally, that as it became a part of my identity in the 4 years I was doing research and getting those challenges, I earlier on wasn't able to peel away the skin of who I was actually to who I wanted to become. And I think who I wanted to become drove me to a point where I was doing as much as I could to become that person, to become that vision of who I had, that I was. After I was able to achieve that, then I spent 10 years kind of relearning who I was and what I wanted out of life. And being an orthopedic spine and academic and everything is great. It looks great on paper, but there's a cost associated with that. And that cost is something that, as time goes on, even to this day, I mean, I'm far older than you. So I'm and I look 20 years older than you. I'm still learning those facets of my own personality. So not to, internalize or make this all about me, but to your question, is you're absolutely right. Sometimes who you want to be becomes your external core, external cover. And once you get it, you open it up, and there's a lot of turmoil inside that you have to sort of piece through. And that's why when I talk directly to Rama, getting help and allowing yourself the ability to talk about mental health, no matter how or where you are in your life, is really, really, really important. I think that's helped me. The second thing about, single-minded focus and should you and would you pivot? If I were to do things, and I was interested, no one asked me this question, if I was to do things differently, what would I have done differently to this point? And you assume that a lot of people would say, no, I would never do anything differently and blah, blah, blah. Oh, I would do so many things differently. Number one is I would absolutely have a little bit of give in my sail. And I don't know how many of you sail, but oftentimes when you pull the sail and you pull it really, really tight, you can go really fast. But if you give the sail a little bit and allow the wind to sort of turn your sail, it's more of an enjoyable sailing experience. So for me, if I had earlier on said, you know what, orthopedics is what I want to do, I'm going to do my best, but I'm going to give myself the opportunity to pivot in between different other specialties and let it be okay, then I would have done that. I still think I would have gone down the road that I did. But I think that ability to pivot is important, which I didn't have the first couple of years of coming here. And the last thing, before I suck all the oxygen out of the air, is about humility. Two things in that. When I got invited by you, the first person I sent this to was my mom. It was my mother. And she obviously gave me duas, and she's like, Beta khush raho, this is great. And the last thing she wrote was, always be humble. And my mom is a world-renowned scientist. Like she won the Tamgha Imtiyaz, and she's she worked on the thalassemia gene in our culture and stuff. She's published 300, 400. She's incredible. I'm the dumb one in the family. Like, I honestly feel like my dad's a PhD, my sister's done an MBA, she just graduated after going to medical school, she got her master's in health. I mean, so I'm the simpleton in the family. So to your point, if I just look across the dinner table, you know, the humility comes naturally, because I see in my own life and certainly in my friends, like, you have done incredible. I mean, I've been following your career, the meteoric rise that you've had for the last 10 years, and you're such an inspiration that I, to this day, continue to draw inspiration from you and Asad and everyone. So it's easy to be humble when you're surrounded by superstars.
Thank you so much, Dr. Safdar. Sorry, Dr. Aisha, we just had one question from the audience. There are some of our participants want to know if they could connect with you over social media or in any other ways. Would you be willing or able to share that information with us?
Sure, LinkedIn is probably the best way to connect with me.
Okay, thank you. Sorry, Dr. Aisha, back to you.
No, I just wanted to, I think we're out of time. So Safdar wanted to deeply sort of thank you for doing this. I just kept thinking, you know, as I even wrote to you, that we should have done this earlier, but you know, perhaps everything comes at the right time. There is that opportune moment where everything comes together. And now, as you said, you know, with COVID, with learning that there are so many different ways of doing this, we can perhaps have you join us at AKU a lot more, and perhaps you know, engage you with our students and you know, faculty. There's just always so much to learn. And of course, next time you're in Lahore, there's no way that you're not coming to Karachi.
I absolutely will. Thank you.
Thank you once again. This was absolutely wonderful. You know, I think we're all feeling a lot more inspired with this. And you know, kind of, when I think of perseverance, and I was thinking about something around resilience, you automatically came to mind. So again, thank you. Really appreciate having you.
Thank you very much, Aisha. Thank you, everybody.
Thank you, Dr. Safdar. Take care.
Thank you so much.